protection. Senator Baldwin.
Thank you. I want to thank you, Senator Murray and Chairman Sanders, for holding this hearing. Because in the wake of the overturning of Roe, I think we must keep drawing attention to the dire consequences on women's health across this country, and particularly in my home state, states like Wisconsin. Before the Supreme Court overturned Roe versus Wade, generations of women in this country had only known a country with the right to abortion care, and they only knew a country where every woman had the freedom to make their own choices about if and when to start a family. But when those freedoms were stripped away, Wisconsinites were sent back to the year 1849, the era. They live under a pre-Civil War criminal ban on abortion care. And I've heard such horrifying stories since that ban went into effect about women bleeding out, about contracting life-threatening infections before receiving care, about women forced to travel hours and hours away from their families and support systems to receive care for an unviable pregnancy. Thankfully, more recently, Wisconsin has been able to take important steps to restore abortion services in 3 communities. 3 counties. We have 72 counties. However, without access to care statewide, too many Wisconsinites must still drive hours, take time off work, arrange for childcare, and face medically unnecessary barriers before getting the health care they need. And while some people debate whether it should be the state or the federal government who should decide abortion rights, I believe it's women who should decide about these issues. And that's why we must pass the Women's Health Protection Act, which I author, ensuring that women have the right to make healthcare decisions and freedom to access abortion care no matter where they live. Dr. Linden, I'm so glad that you are here today to share your experience about providing care in Wisconsin. Your testimony highlights the impossible landscape that you and other providers have been forced to navigate in the wake of the Dobbs decision and the effects on real patients in the state of Wisconsin. These stories aren't hypotheticals. They're about real people. And I wanted you to tell us a little bit more about how patients in Wisconsin were affected immediately after Dobbs. How was the Dobbs decision and Wisconsin's archaic 1849 law, how has that harmed Wisconsinites? And I imagine there were people who had appointments for care on the day that the Dobbs decision came out.
Absolutely. Thank you, Senator Baldwin. So, yeah, you're exactly right. Because of the 1849 law, this was not a law that if Dobbs was passed, then we had 30 days or 90 days or whatever. It was, of course, as we've mentioned a couple times, there have been questions about the enforceability, but because of the risks of $10,000 fines and 6 years in prison, that went into effect for us immediately. So at 9:10 a.m. on the 24th of June, we ceased providing care that moment. We had patients in our clinic. We had patients scheduled the next day, and staff members had to go out into the lobby and tell them, because of something that just happened states away, you cannot receive care here today. And it was incredibly difficult for patients and staff to try to figure out next steps to help them get health care.
Thank you. I've introduced legislation that I just described, the Women's Health Protection Act. This bill would guarantee that doctors have the freedom to provide abortion care and give patients the ability to receive the care they need nationwide. How would passage of that act impact in Wisconsin and improve care for patients right now?
Thank you. And as a Wisconsinite, I do want to thank you very much for your leadership on this issue. As I mentioned, and as you mentioned, we've resumed abortion care in Wisconsin, but the future of abortion access in Wisconsin is anything but clear. Even as we are providing abortion care right now, we are still practicing under medically unnecessary restrictions, including 24-hour waiting periods, ban on telemedicine, parental consent law, mandatory ultrasounds, et cetera. So as a physician who sees the impact of these restrictions every single day, I can tell you that federal protections for abortion access will only improve the care that we can provide our patients in Wisconsin.
Thank you. And what do you want us to know about the current state of, um, uh, tell us how these barriers that you just described that are in part of state law, how do they affect patients that you see?
I think first and foremost, they delay care. We know, as you mentioned, abortion is only accessible in Wisconsin right now in 3 counties. Our state is a lot bigger than 3 counties, so patients are already having to travel long distances. We know that 24-hour bans are often not 24 hours. We have a same physician law in the state of Wisconsin, so the patient has the same physician for a counseling appointment is to receive their medication abortion. So oftentimes between those 2 appointments, it can be a week or plus before they can come back. And abortion is an incredibly time-sensitive procedure. So all of these additional restrictions are creating hoops and barriers for patients to receive routine, or what should be routine health care.
Thank you.